All right. Well, while everybody's joining on, I'm Cliff Dupre. I'm with the Salute America team here at UT Health San Antonio. And welcome to a fourth webinar in our sixth webinar series, Let's Address Health Equity Together. Today's webinar is Men, Why Should You Get Screened for Cancer? Which is a timely topic here for Men's Health Week and Men's Health Month in June. Our moderator today is Dr. Emily Ramirez. Dr. Ramirez is Director of Salute America and its home-based Institute for Health Promotion Research at UT Health San Antonio. She spent over 30 years directing research on communication to reduce chronic disease and cancer health disparities affecting the Latino population. She is also Associate Director of Cancer Outreach and Engagement at the NCI-designated Mays Cancer Center here at UT Health San Antonio. I'd like to hand it off to Dr. Ramirez at this time.
Thank you so much, Cliff, and good afternoon, everyone, and welcome to our webinar on Let's Address Health Equity together, because as you all well know, many of our underrepresented populations are not fully vested in their health, and we really want to provide them with the information that they need. And as Cliff mentioned, this week we're really focusing on men's health, on the importance of encouraging our men to really come in for screening and to reduce their risk for cancer. And this month is Men's Health Month, as well as next week, they're really kicking off Men's Health Week. So right now, the average male kind of pays less attention to their health than the average woman. And compared to women, men are sometimes more likely to drink a little more alcohol, to use a little more tobacco, or perhaps to make risky choices, and they really don't necessarily take their health into consideration. And so we really want to provide information of why it's important for men to really come in to see the doctor, get their primary care checkups done, and get those regular checkups done on a regular basis. And we'd like to also demystify some myths that we know exist in particularly some of our Latino males. Latino men and men of color are even less likely than their peers to get important screening. This has been especially true during the COVID pandemic, when many men put off their screenings and their routine care. And this can contribute to health disparities in terms of survival and quality of life. Fortunately for us, we have partnered up with Genentech and in collaboration with the Mays Cancer Center at UT Health San Antonio to help discuss these cultural issues and to talk about other barriers that individuals may have to screening, and to help demystify the different types of screening tests, and to discuss the importance of sharing stories from Latino males to say why they feel it's important to get screened and how screening has made a difference in their lives. With us to our program today, we have a wonderful panel, and we're very grateful that each one of you has been able to join us. We have Dr. Daniel Alvarez, and I'm just going to mention the names, and then each one will, I'll call on them to say a few remarks, and then we'll have some Q&A at the end. But Dr. Daniel Alvarez is with Genentech and has really provided his time to be here with us and their support. We also have Jeff Zavik. He is representing Dr. Ramon Cancino, whose wife just had a little baby girl, so we're excited for them, and we appreciate Dr. Savek for joining us today. Dr. Savek is a clinical assistant professor who conducts both a hybrid practice of both primary care and sports medicine at our UT Health San Antonio Hill Country and Mark clinics in San Antonio. With us today is also Gabe Canales, who is a prostate cancer survivor and whose mission is to get more men engaged and take life-saving actions through his Blue Cure Foundation. Blue Cure aims to change the cancer conversation and to promote cancer prevention and screening. And we also have Daniel Garza, who's a comedian and actor, and we've had the fortunate opportunity of having him at our conference on advancing the science of cancer. And he's also just an amazing patient advocate who shares his experience not only with cancer, but also with HIV and his experiences on social media. Through his production company, Daniel and his partner, Christian, stream content and positive messages regarding HIV, cancer, and to reach out to the LGBT communities. So again, thank you to each and every one of our panelists. We're so grateful for you to be here today. Our first speaker today represents our webinar co-sponsor, Genentech, which is a biotechnology company and a member of the Roche Group. Dr. Daniel Alvarez is part of the Genentech's Health Equity and Inclusive Research for which he partners internally and externally to contribute to addressing disparities in healthcare and the representation of minorities and underrepresented patients in clinical trials. So we really are grateful for each and every one of you to be here with us today. And I'd like Dr. Alvarez to share what advice he has for men regarding their cancer screening and why this is so important.
Thank you. Thank you. Good afternoon, everyone. And it's really a pleasure to be part of this panel with amazing panelists and with the audience. This is a topic really close to Genentech and also really close to my heart and Hispanic, Latino medical doctor, patients, and men. I really feel really related to what this topic, and that's so exciting to me to be part of this panel. For Genentech, maybe many of you know Genentech. We are glad to be part of working together on this. We are a company that is really focused on delivering scientific innovations for patients, for the community, for people, and improve outcomes for those group of all those patients that could benefit for our medicines, but also doing in a diversity inclusion way, considering health equity, and really bringing the most from everyone that work in the company and thinking broadly, more than not only the diseases, as also thinking the society. For us, we work in really specialized medicine for treat cancer for many years. I mean, we lead biotech company in oncology, but everything starts with getting patient on board, with getting the right patient on board that represent the clinical trials. That's an opportunity that Dr. Ramirez mentioned. I mean, it's really an opportunity to have that representation in clinical trials and really the medicine that not just all companies are all partnered for patients really are studying the same population in Latino and in Black African American and in men, in women, in children, and really who is going to use those medicines. For Genentech, we address diversity and inclusion as the core of what we do. We have three key pillars that I would like to share very briefly. One is fostering belonging. That is really about us, who we are. We really want to have people working with us and work for retain, attract, and develop people that represent what is really the society. And we appreciate that diverse way of thinking and reward that. And we really want that patients that benefit from solutions that we made are really part of that, the people who work in the organizations. The second pillar is really advanced health equity and inclusive research. That's really close to what I do. I am a medical doctor and I work in that area specifically. And that's what we want. I mentioned before, we want that representation in clinical trials of patients that will future benefit from the medicine of our innovation. But we also want to really put a lens in health equity. And we mentioned later, we can mention some of the initiatives in terms specifically screening for underrepresented group in cancer, but bringing just the medicine to all patients that need it is in the core of what we do with many of the projects and partnerships like this one. And the third pillar for us is transform society. We really think that it is above, our responsibility is above and beyond the scope of the research and development. This delivery solution is also with the society. And that's where working with the students, working in the communities, doing partners like this one, really can make an impact there. Well, I will stop here and we'll give the word back to Dr. Ramirez, and happy to continue the discussion.
Great. Thank you so much for joining us. We really appreciate it. Dr. Savick, you've seen a lot of patients. What do men tell you in terms of why they postpone coming in for screening, and what screenings do you recommend for males?
So because a lot of times they don't really give me a reason of why they postpone screenings, but it is something that I definitely see with my male patients. Frequently, I think they associate coming to the doctor means that something has to be wrong, but I definitely encourage all my patients that a yearly physical is great, and that's a great time to catch up on a lot of these screenings. Because if we're only coming in during issues, sometimes we may run out of time in the visit to get to things like the routine cancer screenings we recommend. In terms of the cancer screenings that I do recommend, it all varies by like age group and population. Probably the most common one that gets talked about is the colorectal cancer screening. Most of the times people go with the colonoscopy, but that can also be one of the things that patients are the most afraid of. So I do, try to talk about what goes on during the procedure, what their concerns might be, try to alleviate those things. And something I do, not just with colonoscopies, but with anything, if it's something I've undergone myself, I do try to use that as a way to reassure patients and speak from personal experience. And so colonoscopies are one of those. And so that's anyone 45 years and older that we recommend those for. Within men, we also have prostate cancer screening starting at 50 or older. And that one is a little bit more complicated. It used to be that PSAs were recommended, which is a blood work. PSA, prostate specific antigen, is just a blood test. So if they're getting any other blood test done, we can always add it along with it. It used to be recommended for everyone, but now we kind of like to discuss that with the patient and see if that's something that they want to go forward with. The benefits definitely are that it can catch prostate cancer early, and it can get them in with a urologist sooner rather than later, which is the specialty that tends to treat that. And then the last big one we have is lung cancer screening. That one has very specific requirements. So I do have them here because I didn't want to say them wrong. So adults 50 to 80 who have a 20 pack year smoking history and who are still smoking or quit within the last 15 years. And a pack year history is just a calculation we can do based on their smoking history. And the recommendation there is a low dose CT, which is a really easy test. You just basically lay there and just go through. I tell patients it's like a big donut that just scans you really quick in and out, and it can catch any early nodules or other concerns for lung cancer. That actually across the board is one of our cancer screenings that we have people do the lowest. I found a statistic that said in 2018, only 5 to 6% of eligible adults in the US have had their low dose CTs for lung cancer screening. And so that's one that we're definitely working on really hard here. And we have other projects at UT working with that. So those were kind of the main ones I wanted to go over, at least for the male population.
Great. Is there anything that they should know if they have family members with cancer? And
yes.
does the for screening change for them?
Mm-hmm. Yeah, so especially at least in the male population, colon cancer can move down if in terms of how early you get it done based on if you had a first degree relative. So that means sibling, parent, or child that was developed or diagnosed with colon cancer. You could be due for it sooner than the 45-year range that we use just in the normal risk population.
Great, thank you, appreciate it. Thank you so much. Daniel, what cultural issues have you come across or have you seen in Latino males in terms of why they're hesitant about coming in for screening?
Sure, first of all, thank you so much for the invitation, and saludos a todos. Hello, everybody. I think that within the Latino community, there's always the obvious ones. Men, the machismo, we don't want to go get checked, especially when it's something that has to do with anal, colorectal. There's the probes, there's the colonoscopies. I think as machos, we don't want to do that procedure. There is I call it it's cultural. We're stubborn as Latino men. We think we We think we know everything. We think we can handle everything. And then there's a lot of symptoms that get misdiagnosed. Sometimes there's overworking, nutrition. I always call it's the three: the religious, the social, and the cultural of being a Latino man, that we don't want to get checked, that we don't go get checked. There's an inferior complex, like if I go get checked, there's something wrong with me. So I think it kind of interferes. There's a lot of interference into why I believe, based on my experience, because I fall prey to it too. There are times when I don't want to go get checked, when I don't want to go to the doctor, when I believe I have all the answers, or I've Googled my symptoms and believe that I can fix everything on my own. And also, I think based on the social norms, like working conditions, if you, depending on where you are in the country, a lot of people work several jobs. You're constantly working. There's no time. There's no time in the schedule to be sick. So there's no time to go to the doctor. Religiously, Dios me va a ayudar. God's gonna help me. Like, I've heard plenty of people in my family and my areas, like, si me voy a morir, Dios quiere. If I'm gonna die, it's because God wants me to. It's like, no, that doesn't have to happen. You can go to the doctor. So I believe it's a trifecta. It's religion, it's social norms, and culture that sometimes stops Latino men from going to the doctors.
Wow, thank you. Yes, you're so right on, right? We hear that very often. I know I don't need to go in, and so these are some of the things that, as sisters or wives of our men, it's really hard to get them in. So thank you for sharing that. Gabe, can you share a little bit about your experience with cancer, and again, why you feel it's so important to engage Latino males to get screened?
Hey, Gabe, you're on mute.
Yeah.
Sorry.
Can you all hear me?
Yes.
Can you hear me? Okay. I was diagnosed with early stage prostate cancer in 2010 at age 35. I had no symptoms, no family history, and it was only because I'd gone to get a physical. And I didn't get a checkup for a few decades. I mean, since I played high school sports. And I just on a whim decided to get a checkup, and numbers that were, I was at the time I was overweight. I had a lot of issues with managing my anxiety and stress. My cholesterol was high, blood pressure. My lifestyle I wasn't living the right way. And so when I was told that I had a high PSA, and I'm a pretty educated guy, with some grad school, and I didn't know what a PSA was, and I thought that the doctor was trying to hire my marketing company for a public service announcement. That was the disconnect. And when they said that my PSA was high and I needed to retest, I told my dad, and my dad said, "They're just trying to bill the insurance company." He said, "Suck it up. Don't even call them back." And that's the mentality of my father and my grandfather. Everything growing up was always suck it up. You're okay. You're not sick. So I tested again, and my PSA actually went up more. Then I had a biopsy, and then I received a diagnosis of early stage prostate cancer. And so since 2010, and after my diagnosis, when I shared that with a lot of my friends in their 20s, 30s, and 40s, none of them knew anything about prostate cancer. They didn't know anything about a PSA. So I felt like it was important for me. I was like, I can't be the only one that had this, even though that year I looked into it, there were 1.9 million 35-year-old men living in America. And I'm the only one that I know of diagnosed at age 35. But I felt it was really important because men's health literacy, with all the educated guys I kept talking to, they didn't know anything about that. So that's why I started a nonprofit, to try to raise awareness of that. But also because I was fortunate that I had the ability to see 6 urologists, but it was one urologist out of those 6 at Columbia in New York City who asked me a question. He said, "What's your diet?" And then when he started asking me about my diet and lifestyle, and asked about other men in my family that died prematurely from heart disease, diabetes, and stroke, he said something that I thought was really startling. He says, I believe you have early stage prostate cancer because of your dietary and lifestyle habits. And he said, though prostate cancer doesn't run in your family, lifestyle habits do. So it was part of the mission to try to also raise awareness, educate men about the role of lifestyle as far as chronic disease and cancer initiation and progression. And in my decade of advocacy work with men, I've also really tried to provide information on the intersection of mental health and how that relates to our physical health. And so men in general, I've found there's a lot of shame, and there's also a huge aspect of out of sight, out of mind. You know, even if I have these symptoms, if I don't go to the doctor, if I don't see it, then it's not there, but it is. And oftentimes it gets worse. Yeah, and I have noticed it, and I've seen it with, again, men in general, but in particular, Black and Hispanic men. And in my family, I just think that it's just culture. Like, you know, it's culture. But I find that one of the ways in which we overcome that shame and that stigma is by sharing stories and by doing what we're doing today. And openness has gotten a lot of walls down for me and my advocacy when talking to groups of men and all kinds of men. Because I've had a lot of men tell me early on when I started posting about prostate cancer in my journey, if I would post something about prostatectomy, or when I would post something about erectile dysfunction and men who were overtreated, there would be men that would post, well, I had a prostatectomy and I'm fine, I can get it up. But then later they would private message me telling me that they couldn't and that they were depressed or suicidal. So there's always this, you know, what I present, you know, out here and what's really going on. And I found that the more vulnerable and the more that we share, the more people feel comfortable talking and opening up. And that's what also really removes those barriers.
Yeah, that's great. Well, thank you for sharing your story and that importance, and what you have noted, you know, that you know, how to motivate males to come in is really really critical for their screening. So thank you. I'd like to go back to Dr. Alvarez and ask, what specifically is Genentech working on with regards to screening, to helping increase screening rates among men, particularly men of color? Dr. Alvarez?
Thank you, Dr. Ramirez, and really inspiring Daniel, and gave stories. This topic is quite relevant, and for us, talking about recent examples, what we have been doing, we found that not only us, I'm talking with patients, leaders, providers, physicians, we found that with COVID-19, with the pandemic, I mean, patients really, less than 50% of patients that need to go to screening don't resume screening, just are missing, are not showing up. And we found this is something really critical, because it will go on top. It will take time to recover all the effort that has happened for having these patients screening, considering risk factors and guidance. And this was quite high, the difference in underserved groups, in community, and even in Hispanics and Afro-American situations. And then we really went and had discussion with the American Cancer Society, and we are proud to say that we are founded with them, and they leading with the CDC a campaign that is called Get Screened. And that campaign is really an effort. It's public. You can go to the American Cancer Society place and you can find. It's really to encourage patients to go there and to find, according to group of age, what screen you should receive. But it's also a Q&A of why you should receive this, and also connecting them with places if they really want to do it. I mean, that's one of the things that we do, and it's really connected with the situation we found in the pandemic, and found very supportive for that. Other thing that we have been doing, that impacts the Hispanic community, impact men too, is lung cancer. Well, it's you all know lung cancer is first cause of death in Hispanic men, and Dr. Sek mentioned about some data. I mean, less than 10% of, in general population, less than 10% of patients that need to be screened because I high risk are screened. And if you see that, you look at that with Hispanics and underserved groups, I mean, that's number are even lower. And then we work in a project with GO2 long foundations, with American Cancer Society. We work in those projects, and we really we're in that campaign. The campaign is Screen Your Lungs. There is also a website, but what's the value of really that? That is that patients, and Dr. Sek mentioned about what patient needs to be screened. There is that guidance for that. The value for that is that patients can go to that site and can get a quick test quiz and to understand if they need to be screened or not. That's the third point. They can also find questions and answers why need to be screened, and questions to really bring to the healthcare provider to understand more about that, and even to mitigate some of the fears that patient feels to get in that. But this has been really successful campaign. Screen Your Lungs, it can be easily find that or ORG. And what I like also about this campaign and this partnership is that we also look in the way to connect patients that really don't have a primary care physicians or really don't have even are uninsured, and they really want to, because I see that in the community where I live, in family, friends, I'm not insured, I don't have primary care physicians. Then how do I start? How do I start? That's the place that we connect that. And perhaps the last example that is really touched and is happening also in Texas is about the prevention of hepatocellular carcinoma or liver cancer. It's the most common type of cancer, of liver cancer, hepatocellular carcinoma. It's also high the incidence in Latinos. In men, it's 3 times more often than in women. And it are many risk factors related to that, from hepatitis, viral hepatitis, but also that are related to obesity, to alcohol consumption, and it's really not known. It's not very well known. And then there is another campaign that we worked on last year, and that is still working, that is against liver cancer. That it has information for patients and it has information for providers. It talks about the disease. It really creates awareness. It brings educational material, and it brings some guidance why you should do it. And I think that the value of that is we really want that all patients that have the same opportunity to wear screening. We also think as Janet that this is we have an important role here by doing partnerships and collaborations, and that's why having this conversation with these cross-functional groups here, I think that we bring the best opportunity for patients.
Good. Well, thank you so much, Dr. Alvarez. And Dr. Sek, in terms of the different types of tests that could be done for colon cancer, there's Cologuard and there's colonoscopies. And if you have a patient that's really hesitant, what would be your recommendation for them, and how would you convince them to have the best test done?
So that comes up a lot. And so I kind of go, through the procedure for them. I feel like a lot of men are just scared of a colonoscopy because it's just this procedure that they've heard mentioned offhandedly by one of their friends, but they didn't really get full details. So a lot of times just walking them through, this is what happens the day before, this is what you'll have to do. You go there, you'll be asleep. A lot of times being asleep reassures them. I think people have this fear that they're awake during the colonoscopy. So I'm like, they're sedated, you don't remember it. You wake up in the recovery room. You have a normal day afterwards. And so it's usually how I try to walk them through the colonoscopy. If they're still resistant, then I do like to use the stool studies as like a middle ground to meet them at, because they can be a less scary thing. Typically, the companies will mail the kits to their home. They collect a stool sample, they put it into the kit, and then they mail it back, and then we get results. The only reason I kind of only use it as a compromise, and the only reason I tell patients that is because a stool study only tells us positive or negative. It doesn't really, negative means, okay, no concerns for cancer on the stool sample that was submitted. Positive means there are some concerns, but that means they still have to have a colonoscopy afterwards. So I do like to let them know, we can do this, but there's still a chance you're going to end up with a colonoscopy. Sometimes that does change their mind too, because then they're just like, oh, forget it, we'll just do the colonoscopy to start. And so I think a lot of times it's just the unknown. I think we've talked about, a few of the panelists have talked about it. It's the unknown that scares people. So.
Do you mind if I say something about that real fast?
Go right ahead.
Okay, so I'm 48 and I recently had a Cologuard cancer screening test. My insurance would cover that or the colonoscopy. So I did the Cologuard, sent the test off, and flew out to LA, met my cousin and her boyfriend. And the day that I went out there, he had a colonoscopy, super healthy guy, marathon runner. But when we picked him up, we found out that they removed 3 polyps. And then in the back of my mind, even though I got my test back that was negative, I thought in the back of my mind, I should have done that. I actually regret not getting the colonoscopy because it's like, it doesn't tell you if you have polyps. So that's just my little 2 cents about that.
Yep. But, and I guess speaking of that, I should have mentioned this too. Any male that has a history of polyps, like on a prior colonoscopy, actually should not do a Cologuard. They should always do a colonoscopy from there forward. So.
Right. And then if polyps are detected, there's a different screening. You go through another screening, but a shorter time period. Is that correct? You've had to come in sooner, not.
I see what you're asking. Okay. So that depends. So if polyps are found, they'll biopsy them, which does mean they take a small tissue sample, but you really don't notice. And they get sent to a pathologist, which is a doctor that specially reads those or reviews those things. And based on their results, they'll determine a follow-up for you. So normal colonoscopy or non-concerning polyps is every 10 years, but sometimes that duration can be shortened to every 7, 5, 3, sometimes every year, depending on what is found. So, and that's usually something, if they took polyps, you'll get that information a couple weeks after the colonoscopy is done.
Okay, great. Well, thank you so much. Daniel, what would you tell your abuelo, your father, your tío, or other family members about getting screened? And how did you get over some of these hesitancies that you had?
Sure. Let me go to the second part first, because that would make more sense. Just to follow into the pattern, but when I went, my cancer was found, again, talking about the machismo and the terco and the stubbornness of it all. I actually had a hernia, and I'd had a hernia for a long time, and it got to the point that it was a strangulated intestine that was bothering me. But I was so macho that I didn't want to stop working, because I knew it was going to be surgery and it would be about 6 weeks. And of course, the world will stop if I'm not working and not part of it. So I didn't want the surgery until my doctor made me get the surgery. After the surgery, post-surgery, and the recoup time in my checkup is when I was still having some complications, because I was bloated, couldn't go to the bathroom, and we thought it was strangulated intestine. Turns out they just did a finger probe, and they found they could feel the mass because it was anal cancer, so it was easy to detect. That's what led me to the colonoscopy. And I'm going to tell folks just here, really the worst part about the colonoscopies is the prep for it. The colonoscopy itself, you're asleep, you're gone, you don't even feel a thing. It's that juice that they give you beforehand. Call me on that, I'll give you some tips. But it was that led me to get screened and then get the colonoscopy. And that's where they found the cancer. So that's where the problem was. What I would tell my tios, my abuelo, my dad, is getting to where I am now, because the outcome is I'm 7 years post-cancer, but I had complications with radiation. So I have an ostomy, and the spirit, mind, and body results of that, how it affected me, the way I thought about myself, the way I thought about my body, the way it affected my spirit. It didn't have to get to that point had I gone and get checked a lot sooner. I was 44 when I was diagnosed with cancer. So I think it's fair to bring at this point a conversation about LGBT, gay men too. There's a lot of times that, for instance, in gay men, it goes undiagnosed because some of the symptoms are associated with sexual activity. And so most gay men are not wanting to go get checked. So I fall into the circle mates with me. I both have my Latino culture and being a gay man. So there was a lot of things that stopped me from wanting to go check because I didn't want to know. And as we said, like in my family, si no hablamos, no es. If we don't talk about it, it's not true. And I did not want to have that conversation. I tell a lot of folks, especially in the gay community, if they are sexually active, to get screened sooner and younger, if possible, because tears can cause problems too. HPV, and in my case, HIV. For my Latino family, I talk about the outcomes. You don't have to get to where I am now. Should you just take that time to go get checked? One day to go to the doctor. Un día que pierdas, one day that you lose from work or whatever activity you think is more important is going to prevent you from having to be home for a year because you're having all these troubles that I went through. If there was a time machine and I could go back, number one, I would, because I wouldn't want to be in the situation. But number two, I'm able to talk about it and I'm still here to share. And so a todos aquellos que están allá, if you're listening, pierde un día, go to the doctor, just lose one day, and it could definitely save your life. Thank you.
Thank you so much, Daniel. And I'm going to ask Gabe a question, and then we're going to open it up to our audience. We do have a question from Elizabeth. So, but I wanted to go to Gabe first. And Gabe, in your efforts to raise awareness of men's health, what main challenges have you faced? Why do you feel that men push back?
So so what's been often repeated is, again, it's just the masculine norms of what it means for men to be men. And I think that so much of the way that we act and the way that we manage our health is often a result too of what we see in media. And a lot of the media that to this day, I mean, the media that we are inundated with is much more, it's reactive. So I did a few years ago in 2019, I drove almost 9,000 miles around America, drove to over 40 cities and spoke with men. You know, I saw the data on paper, but I wanted to actually have conversations, authentic conversations with men in urban, suburban, and rural communities. And I would often ask them, you know, what do you think are our most pressing health issues? And you know what a lot of men would say? They would say low T, hair, like balding, low protein. I mean, it was often like what I think men are inundated with in commercials. It's what we're bombarded with online as well as on television. And so it was, you know, and it's become acceptable too, I think, for a lot of men to, for men to feel no shame, or for men to be overweight and obese, and just to not confront a lot of the challenges that come with overweight and obesity. Again, it goes back to the see no eat, or the out of sight, out of mind. You know, I just, I see it with my own father, who recently told me that he might need to go to a doctor because he's been bleeding every time he uses the restroom, and he's known that for a year. I said, Dad, why didn't you go get that checked out? I just didn't want to know. I mean, that mentality right there, I think it's just not wanting to confront. It's just the fear that drives that. It's fear that drives that, but it's also this, and I've seen this so much of people just not wanting to confront and believing that it'll just dissipate or it'll just go away. And we all know that when you confront something in its earliest stages is when it's most treatable. So I don't know if I answered your question, but I've seen that a lot of the issues that I've dealt with men, and this is also one of the reasons why early on I didn't go to a doctor for so long, was it was about toughing it out. It was about toughing it out. It was also about not appearing weak. And look at all the portrayals of that men see in media and movies and TV, are sports figures. Everything's about men being hyper masculine. And so how that translates to our health is overcoming and persevering by just, it'll be okay. It's not gonna get me. I'm gonna conquer it. And somehow people think that just, it just will go away. So.
Thank you so much, Gabe. No, right on. Your questions or your comments are extremely valid, and fear is the #1 reason that our Latino community does not come in to be screened. We hear it to this day, and for many of the cancers that we're talking about this afternoon, such as colon and prostate and so forth, we were where breast cancer was 20 years ago. And this is why these educational opportunities are so important. And as you said earlier, the importance of sharing our stories, your stories of why it was important for you to go in, and that you're still here, and all of you are living, such wonderful lives, and how important that is. Elizabeth put a question in the chat that I'd like to share, and I welcome anybody on the panel to respond to this. The question is, how can we normalize the practice of screening in Latino communities? And Elizabeth, thank you so much for that question. She says that many of her patients say, why go looking for problems? Kind of like Daniel was saying, why spend more time and money looking for something when I feel fine? Especially in the light of false positive, it's hard to persuade their patients that the benefits outweigh the risks. So maybe I'll turn it to our physician panelists first, and then I'll ask Gabe or Daniel to comment on.
Well, I can, I guess, talk on the second part of the question.
Okay.
Why spend more time and money to look for something when I feel fine? I mean, I guess it's hard to persuade the patients, but you just have to spend the time to talk with the patients about how the benefits outweigh the risk. And I mean, this goes not only for cancer screening, but I see, that I feel fine in terms of diabetes, in terms of high blood pressure, in terms of all sorts of health problems. And so it's just spending the time to educate patients. I think a lot of times that's where we get the resistance, when we are, rushing from patient to patient. We're like, you're due for a colon cancer screening. Oh no, I don't want it. Okay, just move on. But if you spend the time to explain, this could catch cancer early. It could just be, a small surgery versus a major surgery in the future if we don't do it now, or a major surgery plus chemo and radiation. You just really have to push that the benefits do outweigh the risk. And, depending on the patient's background, you can maybe also talk about how these ages and these criteria are established, because we know that in those populations that the benefits do outweigh the risk. So.
Okay, great. Dr. Alvarez, would you like to add anything?
Yes, thank you. I think that it's a great question. my experience as a physician too is that this needs to be approached also as a family need. I mean, because we have, I mean, screening for breast cancer has get much more better, even when there is an opportunity for some group of patients. But even screening for men is really behind on that. I think one of the things that always has come to my mind, have discussed, well, first, that this cannot be addressed as just, I mean, us from developing medicines and solutions only cannot take this. Salud Latino cannot. I think that this has to come to an entire thinking the topic as collaborations, different stakeholders, thinking in a family, what that family for moving forward, for growth, for bringing that society, for develop as person, need to get screened, and that has a women piece and a men piece that need to be screened. Another thing that I have seen that has worked in terms of promote health and screening is touching those places that patients used to visit and daily life, or considering the daily habits that they have, if considering a barber shop or a place where they have to have the food. I think that we need to engage non-traditional stakeholders in screening that and getting the message to those populations, to those patients. I think that will come from everywhere. Will come from the family. When the approach to the family will come from who are your partners in the community. I think that's the way that this could be done. And educations, of course, starting for school, or that's my point here. Or even when it's a long-term journey.
Right. Yeah. And starting early, right? Starting even with our young males, taking them in to see the doctors, to demystify that doctors are here to help us, and screenings are important. So Gabe or Daniel, any other thoughts on how we maybe can normalize the practices a little bit more?
Go ahead.
Well, and let's be honest, nobody wants to talk about cancer, and nobody wants to talk about colorectal or anal cancer. I call it talking about butt stuff. Nobody wants to talk about it. It's not a topic that you just start up at, at the quinceañera, or you go visit your abuela for coffee on Sunday. It's uncomfortable, especially in the Latino community.
Great. Gabe, your thoughts?
Yeah, I think it's Hispanic men, according to the Office of Minority Health of HHS, 80% of Hispanic men are overweight and have obesity. So Hispanic men are at higher risk of various cancers. When you look at our rates of heart disease, stroke, diabetes, it's through the roof. And our lifestyle plays such a significant part of that. So I think it's important. And, if it's crazy, because if I was white and if I were saying that about Hispanic men, I would get a lot of shame for that. But because I am Hispanic, and because most of the men in my family have died prematurely from lifestyle-driven chronic health conditions, it's important for me to let other Hispanic men know that they are at higher risk and need to get cancer screenings because of lifestyle. Most of the Hispanic men I know are overweight or obese. They're not healthy. And so, it's important. And I have absolutely no problem saying that publicly. It should be said publicly. And it shouldn't be said out of, judgment. I have no problem sharing the pictures of myself before my diagnosis, when I was 40 pounds heavier and I ate like crap, and my lifestyle was out of whack. So I think it's really important to share these messages with men and to encourage them to get screened so that they can treat cancer at its earliest stage, or at least have the awareness of, I need to make some corrections in my life. And part of a healthy lifestyle, and this is something I really emphasize, lifestyle isn't just about eating kale and exercising. I say that sarcastically, but a healthy lifestyle is also getting an annual checkup and getting cancer screenings. That is part of a healthy lifestyle.
Can I add something before Patricia? I know, Patricia, you have your hand up, but I don't want to forget to say this. It's also something that in the gay community, as gay men, we don't want to talk about anal cancer or colorectal. It's something that can possibly stop your sexual activity. It's something that as a gay man, you can identify with, and it is part of it. And I think that in my case, particularly, I was 14 years HIV positive, and I never had the cancer conversation with my doctors. And I think that's the start. And somebody asked in the questions like, what should you ask? And you're right. It's like going to the mechanic. I went in for an oil change and ended up having a whole makeover. But I believe that as an advocate, I need to educate the doctors in my circle to be able to have those conversations. As uncomfortable as they are, like Gabe is saying, sometimes things are just uncomfortable to say, but we need to have those conversations in order to find a stop to this. Thank you.
Thank you. No, and both of you have mentioned two extremely important points. One is that, Gabe, obesity, even in our children, is one of the #1 problems, that we are seeing in the United States. Our Latino children, a third of them are already overweight. So what is their future going to look like in terms of some of the chronic diseases they might be facing? And also, Daniel, the willingness to share family histories when you visit the doctors are so important. And yet again, many of our Latino families are hesitant to share their family history about their health for fear that they might find something else, right? So you both raised some incredible points here, and I thank you for that. Yes, I'm sorry, Doctor. I can't see your hand. I'm sorry. Go right ahead.
Yeah, just want to make a point on this and give a perspective of a researcher. So everybody has made great comments and raised a very, very good questions and issues. But the one thing that I would like to comment is that raising awareness in our community is very important. So that's why health communications take place, like Salud America, for example. So raising awareness and presenting also testimonials of people like Daniel and people like Gabe, real patients that have gone through this situation and that now are promoting why it's important to get early screening is one of the ways that we can overcome, or at least try to overcome those barriers. We have studied this with Dr. Ramirez and at the Institute for Health Promotion Research, and we have found that having those testimonials and talking about the problem, trying to work in the community, not only with the patient, but raise awareness in the community really works. Sometimes because Hispanic families, it's like the mother is the one, usually the female is the one taking care of the rest of the family. The male is more the macho guy that brings the bread and everything. Sometimes we need to go through the female first, to the mother, to the spouse, and say, we can try to promote the screening on for you and your husband also. And she plays a role in promoting that and encouraging that. So, but getting early or getting a screen is saving lives, and placing really or showing the testimonials. We call it role models of real people, real patients that going through that, real people that are Latinos, that when other Latinos see them, oh, they look like me. I mean, he's right. Look what happened to him. What is happening to me? Maybe I need to ask these questions. We need to encourage our patients and our community to be proactive. That when they go to the doctor, they need to ask questions and ask for the screening that they need.
Thank you. Thank you. No, those are very important points that that we try to really get across. And I think the work that Daniel and Gabe are doing is so important through their specific organizations. But we need more of that education coming from communities. And one of the questions that we have here from our panel, from our audience is, it's a great question, is where can I find basic information about understanding about what to ask the doctor? Because again, that conversation between the patient and the doctor can be intimidating because they only may see them once a year and doctors are busy. So Dr. Zach or Dr. Alvarez, any thoughts or comments to that?
I was just looking at one of the links that Dr. Alvarez shared. The cancer.org Get Screened website actually kind of covers those things pretty nicely. And gives ages, and I feel like that is a good resource to look at.
Yes, and even if you check the Screen Your Lungs website as an example, that's totally true that you said, Dr. Ramirez. One of the things is, how do you address this conversation with your physicians, with your doctor? I mean, how to bring that, the equations that gave you the confidence and the trust to keep going and to understand what is happening and to interpret the results to understand what is happening. Well, this is as an example. I agree with Dr. Patricia said that we need to keep working in awareness, to need to keep working, making available resources for patients. We need to think in the culture behind that and approach that in the way that is really relevant for patients that are asking for care. That's in that part of working in cultural training with healthcare providers, working also in some topic that we have worked a lot, getting at this unconscious bias that sometimes limited the opportunity for patients to participate in clinical trials, or limit the opportunity for patient to receive the right diagnosis or the right treatment at the right time. This is something that we need to work together.
Great, thank you so much. And another of our viewers or audience in the audience is asking, is cancer the only thing we need to ask about? Definitely not. We need you to ask about cardiovascular disease, your diabetes. You know, if you're overweight, we really encourage you to work on finding ways to help manage that. And I wanted to go to Gabe, and Gabe, we just have a couple of minutes left before we close. But you know, you've touched a lot on lifestyle changes. What made you change, and you know, what motivated you to change that you can share with others?
So I'll tell you, before my diagnosis, I grew up in Houston, Texas, and I would visit family in South Texas. My diet consisted of, I would probably eat red meat once or twice a day. My favorite food growing up was chicken fried steak, biscuits and cream gravy. Every Thanksgiving, I would go to my grandmother's house in Corpus, and I would literally eat probably 15, 20, 24 tamales. That was Thanksgiving. My diet was so different, and it was so delicious. But it was when my doctor in New York City, I hadn't been asked by any of my previous doctors. They didn't ask me about my diet. They didn't ask me about my lifestyle, but it was that doctor in New York City who asked how I ate. He wanted to know how many hours a night I slept. He wanted to know if so he asked me all kinds of questions. But he said that if you drastically change your diet, you can slow the progression of your early stage prostate cancer. And you can also prevent or significantly reduce your risk of having those chronic health conditions that have killed other men in your family. So I came back to Houston. I met with the then president of MD Anderson Cancer Center, Dr. John Mendelsohn, and he agreed with that doctor at Columbia. And then I was doing more research, and I ran across a study by Dr. Dean Ornish, who had done a trial on reversing heart disease in '99, and he did the same study for prostate cancer in 2005. And so that was a plant-based diet. And so slowly, and listen, I don't finger point, finger wag, and tell people you got to do this, you got to do this, you got to do this. I today am 100% whole foods plant-based. So, I don't eat like vegan fried foods, but I do eat whole food plant-based nutrition. Those are my meals. I tell people, I encourage men, add more plants, because we've seen the Institute of Medicine has said that 95% of Americans don't even meet the minimum daily fiber intake required. And it's more so for men. So most of the men that I've met in the last decade will openly tell me they don't eat enough vegetables, fruits, beans, nuts, seeds, legumes. So it is, that's what got me to change. I lost weight. All the numbers that were bad improved. And so, that's my encouragement for a lot of men, is small changes can lead to better physical and mental health.
Great. Thank you so much. We're kind of at the close now, but I really want to thank the panelists. You all were wonderful. Great questions coming in. Thank you to those who have been listening to this webinar. We really appreciate you being with us today. So it's important to hear from our physicians, survivors, and advocates who are really working to improve screening participation among men, particularly Latinos. We know screening can be, that make the difference in catching cancer early at a stage when it's truly treatable. And so please, all those listening, please encourage, if you're men, make sure you schedule your appointment to see your doctors. If you're listening for the men in your life, please have them take action now and to make that next appointment and ask, about if the cancer screenings are appropriate for them. You're important to your family, and, Father's Day is just coming up. So now's the time to model for your male children and other family members the importance of early screening to prevent cancer. So again, thank you. And we hope you'll stay tuned for our next webinar, which is on clinical trials, scheduled for August the 17th. And we're going to try a different time at 6 p.m. So, and that topic will be, why should I think about joining a clinical trial? We look forward to seeing you there then. Thank you so much for your attention, and we hope you'll join us for the next session.
Gracias.
Thank you.
Thank you.
Thanks, everybody. Have a great day.
Thank you.